Terrific. Thank you. And thanks everybody for staying. I think, do I not answer this? First of all, I'd like to thank myself for the opportunity to present right now. These are my disclosures. I'm not sure how the hammer came up as my topic, but I want to also disclose that I've never owned a pair of those pants, but actually now I really do wish I had. So there is actually the Texas Hammer, who is a lawyer. For any of those of you who live in Texas, we know this person does exist. The Texas Hammer, his name is Jim Adler, but he looks a bit more like that today. And so if we're talking about proficiency-based training, for most of us in the room, it means meeting a minimum performance goal. Those goals are established by experts in the field of study or in your department or both, that they're clearly defined, objectively assessed, and then typically they're applied in the context of a formal curriculum. So sort of the classic model now for progression from novice to expert, or now at the Sages Master Series, the competency, proficiency, mastery-based training is to sort of integrate your simulation-based training within the context of this type environment. But in reality, it looks a whole lot more like that because it is hammer time. I would say that for most of us in the room, I think my personal experience is that the paradigm shift sort of started with this VR to OR study that Neil Seymour and colleagues put together, where they essentially trained subjects in the lab to predetermined proficiency-based goals within experts in their department on this old-timey virtual reality simulator from way back in the early 2000s. And they trained their residents to proficiency-based goals within this task. It demonstrated a significant improvement in operative performance, specifically when it came to error reduction, and that the result of the tight standard deviations and the fewer errors was that the effect size was enormous for this study. At our institution, Dr. Willis put together a nice study sort of looking at how does proficiency-based or criterion-based training stack up to training based on time or just on repetitions. So he took the FLS tasks 1 and 5, peg transfer and intracorporeal suturing, and divided them up into 3 different groups. I don't know how that projects there, but essentially the group that was randomized or selected to go into the proficiency-based training had the greatest improvement from pre to post testing, had the significant narrowing of their standard deviations, and this was highly statistically significant, of course, and was, as it turns out, not surprisingly, the proficiency-based training group actually spent more time and did more trials, but the net effect of the goal was clear. Danny and Matt Ritter have put together, I think this is sort of a standard for most of us back in the late 2000s, about trying to get our residents prepared for the FLS exam, and they set up these proficiency-based targets for all 5 of the FLS tasks, and they did so to ensure passing on the manual skills portion of the exam, and not surprisingly it worked, and it worked very well. They took just pure medical students, essentially subjects with no experience in laparoscopy at all, put them in the FLS trainer box, trained them up to the same proficiency levels that Ritter and Danny Scott hit. They spent a lot of time training, but their results from pre to post were pretty impressive. And not surprisingly, much research has been done on this, preaching to the choir in the room here, whether it's lap suturing in the porcine or a real model, you can show reduction of errors and improvements in time, training to these proficiency-based targets. Even a basic suturing and knot tying. This is a curriculum that Danny shared with our institution through our tassel group that showed, a really tight tightening up of performance from pre to post based on the same concept. For those of you guys who went to some of the flexible endoscopy and simulation presentations, you saw Matt's presentation on how he used this endoscopic training system that was developed in collaboration with a SAGES grant for this endoscopic training system. For most of you in the room, you're fully aware that residents that are 4th years and younger are going to be required to pass the manual skills part of the FES exam. But the pass rate is not as high as FLS, and there's definite concern amongst most of us in the room about how we're going to get residents to be guaranteed to pass. So we took novices at UT Southwestern and at his institution and trained them up to proficiency-based targets on this ETS system. And at post-testing, 100% of these novices were able to pass the FES portion of the exam. And although I don't have his data or I don't have his slides available, but essentially what he found in the analysis was that their post-testing performance was actually comparable to having performed over 100 flexible endoscopy cases. So this is something that could, I think, easily be applied to training adjuncts as we move forward. So I think most of us will accept that proficiency-based training is a way to effectively train. So how do we implement it and how do we spread the knowledge? In preaching to the choir, obviously, this was just last week or 2 weeks ago at America's Hernia Society. And just as an aside, Cancun is an absolutely fantastic place to have a meeting where David Chen and Will Hope and others are essentially establishing level of recommendations and strength of level of recommendations for all types of inguinal hernia repairs. And this is one of these audience response type scenarios where everyone in the audience was polled and they answered. And this was probably the only question where there was uniform agreement amongst all responders that a proficiency-based simulation-enhanced technical skills training curriculum should be incorporated, specifically when it comes to laparoscopic inguinal hernia repair. Many in the room are probably familiar with, or at least members of, this ACS Surgical Education Institutes. I think this was a great network opportunity for us to share and to collaborate. Now there's over 100 programs designated in the U.S. We are not one at our institution because we have a holdout who is curmudgeon, but I know that having talked to other folks that this is a really effective way to get together and to share ideas. Well, we're pretty biased here in Texas. We generally see the United States as basically two shades. You're either Texas or not Texas. But since everything's better here, one thing that we have done, and this was sort of Danny Scott's idea from about 10 years ago, is that all the residency programs have got together and collaborated essentially to share ideas and train curricula. And it's been a very productive collaborative. I've been very pleased with this. Tons of publications as a result of this, not to mention networking and making friends with colleagues. So we applied this to a robotics curriculum. Essentially, we were taking graduating chief residents that wanted to get sort of their basic certification so they could go to their place of practice when they graduate and get robotic credentialing from day one. We had them apply the proficiency-based training model to the virtual reality simulator on the Da Vinci. Just as an aside, I think it's very interesting how far in 15 years we've come in the VR simulation world. 15 years from now, I think it'd be pretty incredible what we might be able to do simulation-wise. So robotics and margaritas in Houston, I mean, what could be better than that? Essentially, they got hands-on training. This is cadaver-based training. We had 8 residents, 8 faculty, multiple training stations and help. They got the basic training course out of the way. Then the next day they did an advanced training course with robotic tap hernia, Nissen, Coley. They all got their basic training certification and even had a simulator skills competition. What I found fascinating though is on the sort of the post-training questionnaire, the most beneficial training components, the residents were particularly excited or pleased with the sim training as good as it was. So I think it is time to drop the hammer on these folks and get them in shape. So I would say clearly at this point, proficiency-based training has become the standard for technical skills. Once it gets well integrated in the curricula, I think we're going to be taking off and running. Now that we're moving to these EPAs, the emphasis on proficiency-based training will, I think, increase, and we get to continue to collaborate, and we can dance our way into the sunset. Thanks.